Bacterial infection. Bacteria are small organisms that can invade the body, causing illness. These infections usually trigger a protective immune response. Children and adults of any age can develop a bacterial infection. Bacteria can infect any area of the body, including the skin, bladder, lungs, intestines, brains, and more. A bacterial infection can also spread throughout the blood, causing a condition described as sepsis. You can experience several symptoms such as fever, chill, and fatigue as a result of a bacterial infection anywhere in the body. Pain, swelling, redness, and organ dysfunction are common localized symptoms. Pain is common with bacterial infections, and you can have skin pain with a bacterial skin infection, pain when breathing with a lung infection, and abdominal pain with an intestinal infection. You can easily identify redness or swelling on visible parts of the body, such as the skin, throat, or ears. And bacterial infections often cause diminish or alter function of the infected region of the body. Different bacterial infections have a characteristic disease course. The symptoms can begin immediately or after a delay due to an incubation period, and the symptoms can worsen rapidly or may progress slowly. You can be exposed to bacteria from other people through the environment or from eating contaminated foods or drinking contaminated water. The severity of bacterial infections depends largely on the type of bacteria involved. Bacterial infections can run from minor illnesses such as strep throat and ear infections to more life-threatening conditions like meningitis and encephalitis. Your bacterial infection can usually be diagnosed based on the pattern of your symptoms, the location, timing, and severity of your symptoms may be very characteristic of a certain bacterial infection. Blood tests often with a bacterial infection, you may have an elevated number of white blood cells, WBCs, which can be detected on a complete blood count, CBC, imaging studies. If there is a concern that you could have bacterial abscess, an enclosed pus-filled area in or near your internal organs, you may need an imaging study to help identify it. The culture of the bacterial species with antibiotic sensitivity testings is considered the gold standard laboratory test. Often, bacterial infections resolve quickly, even without treatment. However, many bacterial infections need to be treated with prescription antibiotics. Untreated bacterial infections can last or linger, causing major health problems. Friends, if you have an abscess, you may need to have it surgically treated. Your infection could get worse if you use the wrong medication, or you could develop bacterial resistance if you use the medication unnecessarily. Thank you very much